Hi there, welcome back to Amaize Health, your journey to amazing health. Welcome back as we continue the conversation on high blood pressure or hypertension. So, this week we're talking about some of the signs and symptoms, and some of them include having a headache when your blood pressure is high, vision changes, chest pain, swelling in your legs, just to name a few. So, when your blood pressure is elevated, it puts you at increased risk for having a heart attack or a stroke, which can either disable you or lead to your death. These are serious things. So when I have patients that tell me, well, I know when my blood pressure is high because I start to feel a headache or I start to have this symptom, or I don't feel anything, so it must mean my blood pressure is not high. Well, that's not the case, because if you're waiting until your blood pressure is high or you're having symptoms before you start taking your medication, that is not the best way to manage your blood pressure. It means that it's giving your heart more work to do over time. So you really want to take your blood pressure to maintain it at a lower blood pressure than waiting to have symptoms. I also get a lot of patients that say, well, it's not a problem because my blood pressure is high like this all the time and I don't have any issues. So what you don't want to do is wait for it to be so high that you end up having a heart attack or a stroke that can either disable you or ultimately lead to your death. And a lot of times I get patients that realize after it's too late. So let's work together on modifying the things that we can so that we can live longer, healthier lives and stay here with our families as long as possible. So join me next week as we talk about some of the things that we can do and go further into detail about some of the things that we can do to make sure that we're decreasing our blood pressure. And I'm not just talking about taking your medications, although that includes taking your medications. See you next week. Have a great week.